on and so we go back to our slides, and now we are going to start reading. So the leaflet that gives information about gastroscopy. Actually, we know a lot about this procedure. We've already listened to the information about gastroscopy, how the doctor was explaining this to his patient. Now, if we look at the slide, so you can see here that the slide on the slide we can see the only the headings which are given in the leaflet about this procedure, and so I think everything is everything is clear about what each part of the leaflet going to just tell us about. Yes, if this is the first one, what preparation do I need to do? What is it about? What will be, what kind of information will be given here in this part?
Whether to eat or not eat, how many hours
prepare for the procedure, like to collect all the necessary materials,
first of all,
like
inform the
gastroscope
patient.
and
Yes.
inform patient about that particular procedure, like gastroscope.
This is the leaflet to a patient, so it's not about the
Whether
preparation.
the patient should drink or eat anything, how many hours prior the
Yes.
Get
Then,
the consent of the patient.
Look, this is the leaflet which is the aim of this leaflet is to just to give the information to the patient in such a way so that the patient will agree to give the consent. So this is what the doctor is going to tell the patient. And so you can see also the parts, what can I expect after the gastroscopy, and is it reliable, and any side effects or complications from this procedure. Now let's read the leaflet itself, and just to understand how the information is organized here. Who would like to start reading? Mohammed? Yes.
Yes, ma'am. Ma'am, what preparation do I need to do? So, ma'am, the hospital department will usually give you instruction before your test, and ma'am, these commonly instructions are included like do not eat for 4 to 6 hours before the test. The stomach need to be empty. A small sip of water may be allowed up to 2 hours before the test. And ma'am, if you have a sedative, have anybody accompany you have your home. And if you are taking any other medications, tell your doctor it may need to be stopped before the test.
Okay, so well, thank you. And the next piece of information, let's listen to Aman. Aman?
Yes, ma'am. Yes, ma'am. Leaflet about the gastroscopy. What can
read it,
so
please.
I have to read this, okay? Okay. So what can I expect after the gastroscopy? Most people are ready to go home after resting for half an hour or so. If you have had a sedative, you may take a bit longer to be ready to go home. The sedative will normally make you feel quite pleasant and relaxed. However, you should not drive, operate machinery, or drink alcohol for 24 hours after having the sedative. You will need somebody to accompany you to the home and to stay with you for the 24 hours until the effects have fully worn off. Most people are able to resume normal activities after 24 hours.
Okay, thank you. Apeksha, please. The next piece of information for you is for you.
Yes, ma'am. Is gastroscopy reliable? sorry, is gastroscopy reliable? Gastroscopy is a good test for seeing abnormalities in the upper gut. However, it is not foolproof. For example, gastroscopy may not detect a small number of cases of early ulcers or early cancer.
Mhm, mhm. Okay, so I think everything is clear here. And Amisha, the next piece of text is for
Yes,
you.
ma'am. Are there any side effects or complications from having a gastroscopy? Most gastroscopies are done without any problem. Some people have mild sore throat for a day or so afterwards. If you may feel tired or sleepy for several hours if you have a sedative, there are slightly increased risk of developing a chest infection or pneumonia following gastroscopy.
Mhm. Well, and this part is for Nivas.
Yes, ma'am. Leaflet about gastroscopy. Occasionally, the endoscope causes some damage to the gut. This may cause bleeding, infection, and rarely perforation. If any of the following occur within 48 hours after a gastroscopy, consult a doctor immediately. If we have abdominal pain, fever, difficulty in breathing, vomiting, blood. A small number of the people have a heart attack or a stroke during or soon after a gastroscopy. These serious complications are rare in most people who are otherwise reasonably healthy.
Mhm. Okay, this is about complications. Well, and if we have a look at this slide, we can see there are several questions on the text. So please, Vandana, the first question is for you.
Yes, ma'am. Ma'am, the question is, what do you need to do for 4 to 6 hours before the procedure? The answer is you don't eat 4 to 6 hours before the procedure.
Mhm. Okay, yes, good. And now, Sayonika.
How will the sedative makes you feel? Sedative will makes you feel like a little drowsy and relaxed
Mhm.
and sleepy.
Okay, okay, you're right. Well, and the Rohit. Rohit? Is Rohit here? No, Rohit. Rohit disappeared. So Ritik.
Yes, ma'am.
Mhm.
What should you not do for 24 hours after the sedative? Ma'am, you will need to leave, not leave the home, and stay with anybody person or any person with you. So until the full effect cannot be means full effect cannot be worn off.
I see. And what about operating machinery? Can the person operate any machinery or drive a car?
No,
If this-
ma'am, the
no.
person cannot drive the car because the sedative has been taken and hallucination which may cause an accident or something else.
I see. Okay, good. So now, Mohammed, please.
Yes, ma'am. What do you need after this operation? So, ma'am, we do, ma'am, the first thing, ma'am, like sedative. So, ma'am, it will feel us like relaxed, and ma'am, we don't need to drink some alcohol. Now, after this operation, we don't need to drink some alcohol for 24 hours and take some bed rest. And
Okay.
yeah, ma'am.
Okay.
That's all.
Yes, good. And the next is for Aman, number 5. Aman.
Yes, ma'am. How successful are the results for the test? Ma'am, the results of the test are very successful, and accordingly, only the doctors are giving the precautions to being followed, and and
What does the leaflet say about the results of this procedure? I mean, how reliable the results are?
ma'am,
Are
the
they
results are very reliable.
are they
It can cure
100%?
like if we are
Mhm.
if a person is having early ulcers or early cancer or anything or any symptom, then like the results can show up the major cause. So it is very
Yes,
reliable.
it's very reliable, but it can't detect the early cases of some ulcer or cancer.
Okay.
Mhm. And now Apeksha sentence, the question
Yes, ma'am.
number 6. Mhm.
What do some people have afterwards? Some people suffer from a heart attack and abdominal pain, bleeding.
Mhm, mhm. Okay, so this is these
Difficulty
are
in breathing.
Ma'am, some people have chest pain
Difficulty in
also and
breathing,
pneumonia
chest pain.
also.
some complications.
Ma'am,
and
bloody
so-
vomiting.
Yes, okay,
Even fever in some cases.
exactly. Mhm. Well, this is the information about the gastroscopy, and so let us explain the complications, explaining complications and reassuring the patient. Find the adverbs of frequency in the sentences which are given here, and then put them in order, starting with the least frequent. So in the first sentence, procedures like this are usually done under sedation. Where is the adverb of frequency?
Usually.
Usually, yes.
Usually,
In the
Usually.
second sentence, we often get patients who have no complications.
often,
Yes.
Often.
Then number 3, fortunately, we have never had a patient who has had serious complications with
I'm
this
serious.
procedure.
Serious.
Serious.
No, it should be an adverb. Serious is an adjective.
complications,
It's a noun.
Never.
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 Yes, this is
Never.
never is an adverb of frequency. In number 4, the procedure rarely goes wrong.
Really.
Mhm. It always takes me a while to recover from the anesthetic.
A while.
A while.
Or
always,
Always.
Always.
always. Patients sometimes get a headache afterwards.
Ma'am, sometimes.
Sometimes.
Okay,
sometimes,
and if we think of the adverb which describes the action which doesn't happen. So this
Ma'am,
is
some serial complications like,
never. Yes.
yeah,
this is
ma'am, we
never.
have never some serious
And
complications.
if we put all the other adjectives into all the other adverbs in order, what will go next after never?
Sometimes.
Sometimes.
No,
Rarely.
rarely. Rarely.
Rarely.
Then
And
maybe
sometimes.
sometimes. Then
Once in a
Usually.
while.
Once in a while.
Usually or usually.
often. Yes.
Often.
often,
Oftenly.
Then usually
Usually.
and
Always.
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 Yes. Here they are. Never, really, sometimes, often, usually, always. Okay. And the question is, what synonyms do you know for the adverbs? Rarely. What are the other words that mean the same?
I'm like, usually,
unlikely, or
unlikely. Yeah.
Does not happen. Most probably.
Never.
Never.
Okay.
Not.
Hardly
Seldom.
ever.
Once in a
Almost
while.
never. Okay. What about sometimes? What are the other words that mean the same? The
Once
synonyms.
in a while.
Once
Occasionally.
in a while.
occasionally, yes,
Occasionally.
Yes.
occasional,
Or from
What
time to
about-
time.
Yes, from time to time. Often. The synonyms.
usually,
Frequently.
no,
Frequently.
frequently, yes,
And the synonyms to usually, what are they?
Commonly.
Mhm.
yes,
Okay. And yes, here are the synonyms. This is really almost never. There should be not. There shouldn't be the comma. So and often, or usually, typically, habitually, generally. So the synonyms to these words, and we can use them in the description of complications and side effects of some procedures. Now we are going to listen the information about complications. The list, we are going to listen to the list of complications the doctor mentions. And so we should listen and also pay attention to the words that the doctor uses instead of occasionally, automatically, and seldom. And you'll tell me if you hear.
Listening 4. Now,
Do you hear?
Yes, ma'am.
Okay, now.
Listening 4. Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
Well, what phrases does the doctor use instead of the phrases which are given on this slide?
First is
In some
necessarily.
cases,
Automatically,
Really?
instead of automatically, she says not necessarily. Yeah.
Not necessarily. Yeah, ma'am.
Instead of seldom,
Ma'am, very
rarely,
Rarely.
rarely.
yes, very rarely. Instead of occasionally, what does she say?
Sometimes.
In some cases,
Well, or it's very close to
some
occasionally.
patients.
She
I mean,
says
some patients.
on the odd occasion, on the odd occasion. Mhm. And so, well, what are the complications?
Mild sore throat. And if you are being given a sedative, then you will feel tired. Then the chest infection and pneumonia in rare cases. And sometimes the bleeding and infection can be caused in the gut and the puncture of the gullet wall of the stomach.
Exactly. And so the complications are very serious, as we see, and the patient can be
Listening 4.
scared of this information, but the doctor just uses some formulas just to show that this is not dangerous. And now let us listen again to the same information, to the same conversation, and list 3 ways the doctor makes the complications sound less threatening. So she uses some specific words just to show that it's not very threatening. Okay, so let's listen the same one more time.
Listening 4. Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
Okay, what was the first phrase that the doctor uses to reassure the patient?
Assure you in most
I'm a
cases.
mild sore throat and
problem.
sometimes feel drowsy.
Only
And
some
In
people.
most cases,
yes, but
Only some people can.
she says some phrase that a phrase that
Problem free.
yes, she uses the phrase this is the procedure is problem free. She says, I can assure you that in most cases, she says, in most cases the procedure is problem free. Okay. The second formula, what does she say? Or the other way?
Very
not
rare.
mean necessarily
side
you'll get.
Not necessarily like side effect like chest infection
Yes,
and like pneumonia.
You have to be aware of the side effects.
yes, you will not necessarily get this as well. Yeah.
Side effect, but you have to be aware of them.
Mhm. And one more way.
Ma'am, very rarely.
Yes.
In
This
some
happens.
cases like bleeding,
Odd
infection of gut.
Occasionally.
Or occasion.
Exactly. She says, but this happens very
Okay,
rarely.
very rarely, very rarely.
Just
Like
not to
bleeding,
frighten.
infection of gut and gastrostomach.
Yes. Mhm.
Galley
Good.
gastrostomach.
You're right.
Yes.
Well, and
Listening for.
and so now we are going to speak about emotions that patients show. And when doctors see a patient showing emotion, they can make a comment or observation. And I think it's very important for doctors to see the real emotions of people. And this is called acknowledging a visual cue. And now we are going to look at the pictures and sentences. And so in the pictures, you can see people just expressing just various emotions. And let us read the sentences and just find the picture which illustrate the idea which is described in the sentences. So let us listen to start with Sayonika. Number one, please.
It's better to let it all out rather than bloating it up. I guess the E1 because bloating is happening in his stomach.
Is the phrase, this is the phrase said by the doctor to a patient, right? And to
It
let
should
it
be
show.
C.
C, yes. Okay, yes.
See, yeah.
I think better C is
Because-
better because the patient is crying, just letting her emotions out, right? Mhm.
Because the E picture can, ma'am, like similar
It is for
to
different
sentence
image.
5. I can see you are in a pain, ma'am, in that 5.
Yes, you're right.
So, ma'am.
Yes. Mhm. Okay, and in the second, Rohit is absent. Ritik, the second sentence, please.
Yes, ma'am. You look very happy to be going home. It's D, ma'am, because the person seems to be very happy
Yes. The next
after
is,
being hit.
yes, the next is for Mohammed.
Yes, ma'am. I can see you are a bit alarmed by this procedure. Ma'am, like picture A.
Picture A, yes, because
Yes,
this stronger emotions, yes, the person is alarmed.
Yes, ma'am.
Then the Aman, number 4.
Yes, ma'am. You do rather nervous about this. Ma'am, the F1.
F, yes. So there is a difference between pictures A and F. In the F picture, the person is
Yes, ma'am.
biting his her nails, and so this is a kind of nervousness, and person is alarmed in picture A. Well, Muhammad has already said that Apeksha,
Yes,
5.
ma'am. I can see you are in pain is for the E1.
Yes, this is the person is in pain. And Misha, number 6, please.
You look a bit confused by what I have said. It's, I think, B1 because
Yes,
you're not
the
able to
only
understand.
one which is, yes,
Left.
rest, okay. And so on this slide we have more sentences. I mean the sentences from the previous slide that the doctor says to the patient, and then we should complete each doctor's response by adding the most suitable development which the sentences which are given to the right to reassure the patient. Well, let us listen to Nivas, the first sentence,
ma'am.
and find the corresponding. Read it, please.
First one, it's better to let it all out rather than bloating it up.
So, which sentence comes next? So you are telling this to the patient who is crying.
Would A can come corresponding to it. Would you like to make it?
So, would you like me to get you something? Right? This one?
Yes, ma'am. Yes, ma'am.
Okay, like a glass of water, for example. Okay. Well, so Vandana, please.
Yes, ma'am. You look very happy to be going home, so I won't keep you long.
Good. So the next is for Sayunika. Sayunika?
Yes, ma'am.
Number 3.
Ma'am, where?
3.
I can see you're a bit alarmed by the procedure.
And
something. So I won't keep you long.
do you all agree?
No, ma'am.
No,
I
ma'am.
think
No,
Ma'am, I
ma'am.
think
remember you are
F is the
lucky
answer.
we got it early.
Yes.
I think B is the answer.
B.
Ma'am,
Remember, you're lucky
ma'am,
we caught it early, or F, but it won't
But
take
it
long.
won't take a...
yeah, ma'am.
It's
F is the
pain-free.
answer.
Pain-free. Yeah, also
Pain-free.
possible. Yes. Well, the next is for Rohit, who is absent now. Ritik.
Yes, ma'am. You look rather nervous about this. But we will soon give you something helps you relax, so there is no need to worry.
Okay.
The doctor emphasized the patient.
Yes, good. Well, Mohammed, please.
Yes, ma'am. I can see you are in pain. So, ma'am, the answer is, ma'am, like option B. Ma'am, I can see you are in a pain, but remember, you are very lucky we caught it early.
Yes, you are very lucky. You are in pain, but you are very lucky. Or
Ma'am, something like that. Ma'am, doctor diagnosed early. Ma'am, maybe he have some disease due
yes,
to which he are in pain, ma'am.
but
He or she is
we
in
can
pain.
also add something like, would you like me to get you something like a painkiller? Something like this. Good.
C. Ma'am, C can be the possible answer.
Yes. So give you something to help to you relax. Also possible. You're right.
So there is no need to worry.
But C is the answer of fourth one. Na?
It's okay. I mean, it's we can use one and the same just phrase several times.
Okay, ma'am. So, ma'am, the C is the answer. I can see you are in pain, but we will soon give you something to help you relax. So there is no need to worry.
I don't care.
Okay. Also possible. Mhm. Well, who is speaking now? Aman, yes?
Ma'am, you look a bit confused by what I've said. D option. So would you like me to go over it again for you?
Yes, just to explain all the procedure one more time, because the patient doesn't understand it. Okay, and the question here is, in your country, would you say to a worried what would you say to a worried patient, or what would you do if you see the patient like this in the picture?
And first of all, we'll reassure them
Mhm.
We can
about
console them
yeah, we can reassure, we can console about the procedure.
Mhm.
And we
that
can
there is no need to be worried about.
encourage them, yes, to get the treatment.
They can trust us.
Okay. And in your country, in your culture, do people tend to show their emotions or keep the emotions inside? Are they emotional?
Yes,
Indians
Yes,
are
ma'am,
very
they are.
emotional.
very emotional.
Emotional.
I see. Okay. Yes, and it's easier for a doctor to understand if the patient is worried, if he shows emotions. But sometimes it's hard to deal with very strong emotions, right? To come to reassure the patient, to calm him down. Okay, now let us focus on this slide, and here you can see there is the home assignment. There are 6 tests or procedures, and we've read the leaflet today, and you should prepare a leaflet that gives a patient information about one of these procedures. There are 12 students in the group, and you can see that every 2 students should take one of them procedures, and just prepare a leaflet about this procedure. And so it's hard for me to read colostomy, ERCP, endoscopic retrograde, and so in order to read this long word, we need
Cholangiopancreatography.
Perfect. So, because you understand what this what part this word consists of, what the parts of the word. That is why.
Our colon and pancreas.
Pancreas, yes.
Ma'am, the study of colon and pancreas on a
I
graph like something.
I see. Okay. Then,
Ma'am,
yes. Mhm.
ma'am, I've done all the topics and I've sent it that. So shall I delete that and resubmit that?
Who is speaking? Aman?
Share with others.
Aman?
Yes, ma'am, I'm saying.
You've
Yeah.
done this already. Have you prepared the PowerPoint presentation, Aman?
Yes, ma'am, I've prepared, but I've prepared for all the topics and I've sent it individually.
Oh, and how many slides are there?
Ma'am,
Ma'am,
there
on
are
behalf of the group.
7
slides are there.
7
Almost
slides.
six. Yeah.
6 slides. Just you were able to just tell everything about each procedure only on 1 slide. Yes. Okay. In this case, please, Aman, find somebody to work with, and just because you should just work only, make the leaflet about only one procedure in your presentation. And you should
So
work.
shall I do it again?
Yes. It will be easier for you because you found all the necessary information and the material, and you should only rearrange the material just or about only one procedure. And so you should follow the instructions which are given here. Use the bullet points if necessary. Make no more than 5 slides. Come on, 5 slides about one procedure. Write about each complication separately, And you should use the following words and expressions to help you, like sometimes, occasionally, rarely, some people, there are some people, not everyone, and try to use the present simple active and passive voice and the imperative for actions. And look, I start working with the students of other groups on Tuesday in the morning. And we discuss the same material.